Hi, I'm Dylan Heifel. I am the CIS Program Manager or Social Worker here at Kennedale High School, and it is my honor to introduce to you Ryan with Perimeter Behavioral Health. He is a fellow social worker, so I'm very excited to have him here, and he is going to give you guys a presentation about suicide awareness.
Yep, so we're here to talk about suicide awareness. I'm a social worker down at Perimeter in Arlington, about 5 minutes down the road. So why are we talking about this? We're talking about it because it happens. It is the second leading cause of death for 15 to 24-year-olds. The only thing in first place beating it out is accidents, car accidents, things like that. 20% of high school students, 2 out of 10, report serious suicidal thoughts, and 1 out of 10 have a serious attempt at suicide. And 4 out of 5 of those attempts had serious warning signs. And so 4 out of 5 of those times, we can do something to prevent and to intervene. Why do individuals attempt? Why do kids attempt? Kids attempt because it's a solution to a problem. That problem is pain, and that's the way out. They finally found that solution, and they know what to do, right? Get rid of that pain. Obviously, it's not the solution that we want, and it's not a good solution. The brain is still forming in childhood and adolescence, and so that leads to a lot of impulsivity and difficulty with future thinking. It's hard to think beyond high school, beyond college, beyond the test tomorrow. The social media can also make it difficult, comparing lives. I'm not going to be as pretty as that person, as muscular as that person, and having that many followers. There's also a FOMO, fear of missing out as well, seeing highlights of other people's lives. And emotions feel permanent in adolescence, right? I just had a breakup, so I'm real sad, and I'm never going to not feel sad again. Obviously, that's not true, but in teenage years, it feels very true. So what are some warning signs? What things can we look out for in our kids to know when to address, when to ask about suicide? Hopeless. Hopeless is the kind of trigger word for me when I'm talking to someone about suicide. If they have any expression of any sort of hopelessness, I'm immediately going to ask about suicide because that is kind of the number one keyword to pick up on. If they're hopeless and then suddenly they have a bunch of hope, a massive mood swing, check in on that because they might have hope because they finally found that solution to a problem. If they talk about suicide, which sounds obvious but isn't always so obvious, things like I'm just can't go on, I don't want to be here anymore. I was telling some kids the other day, if on Friday you're leaving for the weekend, hey, I'll see you on Monday, and a kid's like, maybe, check in. That's a warning sign. If your child's withdrawn, isolated, they're just staying in their room all the time, keep an eye on that, check in on them. On the other hand, being angry, being really irritable, outside of the norm. Depression isn't always being sad. Sometimes it presents as anger, irritability, aggression. Check in on that. Numbness is even more severe than sadness, right? Because with the sadness, if someone's suicidal, they might still have some things to hang on to. I don't want my family to be sad, my friends to be sad. If somebody's totally numb, they're just not going to care anymore, and that can lead to a high suicide risk. And any of those warning signs combined with severe life changes, death in the family, divorce, bullying, victim of violence, that's a potent combination for suicide as well, and something to keep an eye on. So you've identified some warning signs. Now what do you do, right? Ask. It's simple. It's never going to put the idea of somebody in somebody's head of having suicidal thoughts. You're not going to ask somebody about suicide, and they're going to say, well, that's a great idea. I haven't thought about that. Not a thing that happens. It's perfectly fine to ask. If you're wrong, they're going to go, no, thank you for checking on me. I appreciate you asking, but I'm good. If they are suicidal, they have been so desperate for so long for somebody to ask that question that they are relieved, and they'll likely tell you. So you've asked the question, you've identified that your child has some suicidal thinking going on. Treat it like an emergency. Treat it like you would any other medical emergency. You need somebody to take a look at that now to make sure what the level of risk is, because it can be severe, it can be moderate, it can be low, and you want that checked out on. You want to take suicidal statements seriously every time. We don't want to ever treat it like it's for attention. We want to take every suicidal statement, suicidal behavior seriously, because the risk of being wrong, the outcome of being wrong is really bad. But if we're right, we take care of it, we're going to be okay. And so get help ASAP. You can go to the emergency room if you want to. You can call 911. You can go to any psychiatric hospital for a free assessment, perimeter down the road, 24/7, 365 free assessments. We just figure out what this person needs. So we're looking for, when we do that assessment, a level of care and what the different treatment options are for someone. The social workers, the doctors that assess for suicide are ethically, legally bound to look for the least restrictive option. Okay, so that means least restrictive being outpatient, weekly counseling, a couple times a month counseling, maybe see a doctor once a month, maybe some medications, an antidepressant. Up from there, you have intensive outpatient, medication management, some group therapy a few times a week, partial hospitalization, that's a day program, lots of therapy, lots of medication management, psychiatrists, nurses, the whole 9 yards. The most restrictive is inpatient. That's for severely suicidal cases where they're not safe in the community, at home, at school, in the outside world for a time. Anywhere from 1 to 2 weeks. I tell folks it's kind of like summer camp for mental health, right? They're going to do a lot of groups, a lot of medication adjustments. They're going to have that 24/7 round-the-clock monitoring and safety that is just impossible anywhere else. And how do we prevent suicide or suicidal thoughts from starting in the first place? I tell folks self-care is super important in preventing suicidal thoughts from ever happening in the first place. Even though we're adults and we think our life is stressful, kids' lives are super stressful too. And they don't always have the coping skills that adults have to handle that stress. And so making sure that they're taking care of themselves, doing something they enjoy doing, taking a 20-minute nap after they get home from school before they start their schoolwork, getting some exercise, doing something that they enjoy can help a lot, along with routines. Depression, sometimes you lose that motivation to take a shower, to brush your teeth, to do different things. And making sure you have the routines and the habit and the discipline to do those can stave off some of that. Early intervention is really important as well. The amount of missions that I go through every day that don't have any sort of outpatient services at all is a lot. And so being able to, at the earliest warning sign of anything, hey, your mood is a little off, or I know this big thing happened to you, let's see a therapist for a little bit, that can prevent a lot of increase in severity. And be that safe person that your child can come and talk to about these things. And if you can't be, for whatever reason, find somebody in their life that is, and make sure that that person's accessible to them and that child knows that they can come and talk to them. Having somebody, an adult, a trusted person, a responsible person that they can go to and say, hey, I'm struggling, I'm having depression, I'm having suicidal thoughts, whatever it is, can go a really long way. So here's our contact information if you ever need any assessments or anything, 24/7, 365. They're free. We figure out what you need, and we're a good resource for everyone.
All right. Thank you so much, Perimeter, for providing us such great insight as it relates to suicide awareness. My name is Kenya Evans, and I'm Kennedale ISD social worker for Patterson Elementary. And I have Emily Whitmire, who is the social worker for Delaney Elementary. We're going to just provide some of the information as it relates to the protocols and how we entrust in what we do as a district, as a whole, as a district, to provide safety for our students that experience the outcries.
I am Emily Whitmire. I am the social worker for Delaney Elementary. And I'm just going to kind of walk us through what happens at the district level, at the school level, when a student makes a suicide outcry. So the outcry's been made. Respond, right? So first thing first, all of our staff in KISD is trained to handle the outcries and trained on how our protocols and procedures go. So you don't have to worry about your student making an outcry to someone and they just don't know what they're doing. We're all trained, we all know what we're doing, so kind of put that worry to rest. So when a student makes an outcry about suicide or self-harm, we have a duty as a school to ensure that they get the proper help they need and that they have someone to listen to. So we're gonna kind of walk through each step individually of what we do. So first is the notification. So this is the student who makes the outcry. Maybe it's a teacher, PE teacher, counselor, administrator. The first thing that happens is the school counselor or the school social worker and the administrator is made aware of that outcry because we want someone who can respond properly as well. And any staff member who becomes aware of this like outcry, say the kid says, you know, I have thoughts of hurting myself, harming myself or killing myself, that staff member will stay with them until the school social worker, counselor, administrator comes and handles the situation, takes it to the second step. But a student, once they make the outcry, is not left alone ever throughout the process, because that's unsafe, and we want to make sure they get the proper help. So what comes next is safety, which I just talked about. Is the outcry has been made, the counselor and the social worker and the administrator is made aware of it, the student is not left alone. So then we gather information. That's what the administrator, the counselor, the social worker, that's what they're trained to do. So they sit down with the student and just kind of talk about the feelings and hash it out. How are you feeling today? What has you saying these things? And just kind of have a conversation. And so once that conversation is had and they kind of, gauge where we're at, maybe it's more severe, maybe it's less severe, we contact the parent. Regardless, the parent is always contacted no matter what, because it's important that we as parents or guardians know that our kid has made an outcry, our student has made an outcry. So we've gone through all of that. So we've notified, they said, okay, I'm having suicidal thoughts. The proper people have been notified. The kid's not left alone. The counselor, the social worker, the administrator is now having that open conversation with the student about their feelings. Now the parent's been notified. So our final step is provide resources. We want to make sure that you and your student are connected to the proper resources. So like we had Perimeter, we'll refer you to Perimeter, or whoever else in the area can provide that more extensive help. So maybe they need inpatient or outpatient or hospitalization. We'll refer you to the right people who can make those decisions and help you through that process. So making that transition from school into help outside. So this is KISD Counseling Services. I kind of want to talk about our referral forms and Friends for Life. So our referral forms are online Google Forms that are filled out by teachers, staff, sometimes students. If a student's having a hard day, or if they make an outcry about self-harm or suicide, the counselor referral forms are filled out by the teacher or the student or whoever heard, and that comes straight to the counselors and administrators and social workers, so we can see that and respond quickly. Friends for Life is an anonymous app for bully reporting. So say a student is struggling with bullying, but they have a hard time talking about it. They can use Friends for Life to anonymously report it. That comes to the proper people, and we make sure it gets taken care of, and we can, figure out the situation. And then this is our contact information at the high school, junior high, and the elementary level. So if you have more questions or concerns, or maybe you just want to know a little bit more about our procedures, you can contact us and we'd be happy to talk about it. But thank you so much.
Thank you.